Hi, and welcome to the University of Alabama International Student Orientation. In this session, we are going to cover topics regarding your health. We'll go over healthcare, health insurance, mental health, and substance use. To begin, we will go over a short video that's going to help to introduce the U.S. healthcare system to international students. This is extremely helpful for those who come from nationalized healthcare systems into a privatized healthcare system such as we have here in the United States.
In this short video, we will provide an overview of the U.S. healthcare system and how to seek medical treatment. The first step is what to do before you leave home. Before you travel to the U.S., there's some simple things you can do that will make your life much easier and could prevent you from having to pay for things that are typically not covered under international student insurance plans. 1. Prescription medications. If you are currently taking any prescription medications, such as asthma inhalers, make sure to bring a good supply with you, along with your doctor's notes for those medications. 2. Eye test. Opticians are typically not covered under international student insurance plans, so get a checkup before you travel and make sure you have current prescription glasses and contact lenses. 3. Dentist. Make that visit to the dentist you have been putting off. Dental costs in the USA can be very expensive and will likely not be covered by your insurance plan. 4. General checkup. Go to your doctor and have a checkup before you travel, and make sure all your vaccinations are up to date. With some advanced planning and preparation, you can avoid uncovered expenses when abroad. The U.S. healthcare system offers some of the best medical care in the world, but it is complex, difficult to navigate, and often very expensive. The U.S. system will also likely be very different from the healthcare system you are used to back home. In this section of the video, we offer a few simple tips. First, like most Americans, you will need a private insurance plan, either through your school or one that you purchase directly. There is no universal access or national health care like many countries offer. When you seek any medical care, the provider you choose, hospital, doctor, or clinic, will look to you and to your insurance carrier to get paid for their services. There will be no payment from the government, and healthcare can be very expensive in the U.S. Here are a few recent real-life examples. Appendicitis, $60,493. Fractured humerus, $47,445. Fractured clavicle, $18,393. Car crash or serious illness, $150,000 plus. We hope by now it's clear why you need insurance. However, even with insurance, you should still be prepared to pay some portion of the cost of your medical care. Cost sharing is an important element of the U.S. system, so medical care is never entirely free, and each time you access the system, you should expect some cost. While your insurance plan will typically cover the majority of expenses, there will be copays, deductibles, co-insurance, excluded charges, or some combination of these items that will ensure that you pay something. Carefully review your insurance documentation so you understand how these payments work for your plan. When you get sick or injured, where do you seek care? Here's where it can get complicated. The medical system in the USA is made up of a mixture of many different types of providers. Large and small hospitals, emergency rooms, private doctor's offices, urgent care centers, walk-in clinics, specialists' offices, surgery centers, pharmacies, and our favorite, the on-campus clinic. As daunting as it may look, if you keep a few simple points in mind, seeking medical care does not need to be overly complicated. The main thing to do is, if at all possible, stay out of the emergency room. Emergency rooms in the U.S. are expensive and are designed for life-threatening or very severe illnesses and injuries. If you have the flu or a sprain or minor cut, you can go to an urgent care center, walk-in clinic, on-campus clinic, or doctor's office for a fraction of the cost of the emergency room. The best place to start, if at all possible, is your on-campus health center or clinic. These clinics are typically available at reduced cost or even free, are close and convenient, and even if you end up having to go somewhere else later, will save you money under most insurance plans. Local doctor's offices are a good, affordable place to start your medical care as well. Often called general practitioners or family doctors, These offices typically require an appointment, and some doctors may not accept new or short-term patients. If you can find a doctor you like and get an appointment, it can be the best place to start. Often a more convenient option is a walk-in clinic or urgent care center with long opening hours, no appointment or prior relationship required, and ability to deal with a wide variety of medical issues. These retail providers have become extremely popular. They can cost a bit more than a doctor's office, but much less than an emergency room, and typically accept a wide variety of insurance plans. Of course, for serious or life-threatening illnesses and injuries, go straight to the emergency room connected to your local hospital. They will be prepared to deal with any problem you have and will either treat and release you, admit you, or refer you to another facility. It won't be cheap and it won't be quick, but you are in the right place for a serious case. A doctor at an office, urgent care center, or hospital may write you a prescription for medication. In this case, you will need to go to a local pharmacy to get the prescription filled. There are lots of options available. Walgreens and CVS are two of the more popular nationwide chains, but Walmart and other grocery stores also have pharmacies. In most cases, you will need to pay for the medications fully and then keep copies of your receipts and submit a claim to your insurance company for reimbursement. To review: 1. Prepare before you go. 2. Make sure you have insurance. 3. Plan to pay some costs yourself. 4. Stay out of the emergency room and start your care at an on-campus clinic, doctor's office, or urgent care center whenever possible. We hope that you have found the information in this video helpful and that you have a better understanding of the healthcare system in the U.S. For more detailed information about various U.S. healthcare topics, please visit the Insurance Explained section of International Student Insurance, www.internationalstudentinsurance.com/explained.
As the video has pointed out, there are a number of things you need to do when seeking medical treatment. And you need to think of it in terms of what type of illness or injury you're dealing with. For minor illnesses and injuries, cold, cough, sore throat, flu-like symptoms, fever, minor cuts, a sprain, or skin rashes, you'll want to go to the Student Health Center or an urgent care clinic. These are typically going to be your lowest cost options for medical treatment. If you have a major emergency, such as a major injury like a head injury or severe shortness of breath, loss of consciousness, bleeding that doesn't stop after 10 minutes of direct pressure, that is where you will end up going to the emergency room if it's after hours. If the situation is truly life-threatening and you're unable to get yourself to the emergency room at the hospital, you'll want to call 911 and they'll send an ambulance to you. These, of course, are the most expensive possible sources for your medical care, so you want to only seek these out in major emergencies. For most things, 95% of your everyday medical needs, the Student Health Center or a local urgent care clinic are going to take care of your needs. About the Student Health Center. They are located here on campus at 750 Peter Bryce Boulevard. That's in Tuscaloosa, Alabama, 35401. You can call them at these numbers, 205-348-6262, or reach the pharmacy at 205-348-6276. You can also email them at shc@ua.edu or visit their website, shc.sa.ua.edu. The Student Health Center does not require appointments. You can go see them at any time for medical or injury treatment. Appointment is required for women's health, psychiatry, or dietitian visits. During the fall and the spring semesters, their hours are typically Monday through Thursday, 8 a.m. until 5 p.m., Friday, 9 a.m. to 5 p.m., and on Saturdays and Sundays, they're closed. They're also closed on university holidays and during home game days. Whenever you go visit the Student Health Center, make sure to bring your action card and your insurance information. Now, as a student, you'll be required to submit certain immunization records. You can find the immunization forms on the Student Health Center website under the Forms section, and there's an immunization form there. You can also go to the immunization information on the Student Health Center website, where you'll find more details about how to upload your proof of immunizations. The following are required for all incoming students: a meningitis vaccine, which is 1 dose at the age of 16 or older, 2 measles-containing vaccines, and 1 must be an MR vaccination after 1980. And then you also need to have a TB screening done within 1 year. Immunizations such as the MMR and meningitis vaccinations are available Monday through Thursday from 8 a.m. until 3 p.m. and Friday from 9 a.m. until 3 p.m. The TB skin test can be done on Monday through Wednesday, 8 a.m. until 3 p.m., and on Fridays from 9 a.m. until 3 p.m. No appointment is necessary. You can bring your action card and your health insurance information. And if you have any questions, you can email immunizations@ua.edu or call them at 205-348-6262 or 205-348-4637. Whenever you contact them, be sure to include your CWID. As a University of Alabama international student, you will be automatically enrolled in the UA Student Health Insurance Plan. You can download instructions on how to set up your online account to be able to access your information. And if you would like, you can also go to uhcsr.com/myaccount and click Create an Account. When you go there, you're going to enter your first and your last name, your date of birth, and either your email, your student ID, or your SR ID. You'll create a username and a password and verify your identity either with your email or your cell phone number. For more information, you can go to uhcsr.com/UA. Your UA student health insurance covers services at the Student Health Center, though a copay may be charged at the time of service. It covers hospital services if referred by the Student Health Center, and it covers most emergency hospital visits. The insurance will also cover University of Alabama required immunizations and the TB skin testing. If you have questions or if you need forms, please contact the Student Health Insurance Office at 205-348-4086 or email shc@ua.edu or visit uhcsr.com/UA. In this video, we're going to go over mental health care in the United States and resources that you may need to seek while you're here.
Did you know that almost half of all young adults have had some type of mental health disorder in their lives? And while mental health problems can affect people of all ages, races, genders, and backgrounds, college is a particularly susceptible period. Fortunately, there are many support services to help young people through these challenging times. In this short video, we'll discuss the signs of mental health problems and how to seek treatment for them. Then, we'll dispel some common myths that prevent people from seeking help. But first, let's discuss what mental health is. Mental health is a person's emotional and psychological well-being. It affects how we think, feel, and act, and influences how we make decisions, how we engage with others, how we perform in school, and how we deal with stress. Mental health problems can come in many forms and can often be brought on by stressful situations, like moving to a new country, being away from family and a familiar culture, or worrying about school exams. It's not uncommon for new students in the United States to struggle adjusting to all of these changes at once. Often, people struggle with mental illness because they aren't aware of what it is. A few common warning signs to watch for include feeling helpless or hopeless, having mood swings where you are extremely happy one moment and sad the next, feeling sad and lonely for a long period of time and the feeling doesn't go away, having low energy and little or no desire to engage with others, eating or sleeping too much or too little, smoking or drinking to excess, or using drugs, seeing or hearing things that don't exist. In some cases, it can even come in the form of wanting to harm yourself or others. If you or someone you know experiences these symptoms, you should seek help as soon as you can. Help for mental illness is often referred to as counseling. And getting help for a mental health condition early is very important. The longer you wait, the more difficult it can be to manage. If you or someone you know has a mental health condition, there are many places in the United States to get help. The best place to start is your on-campus counseling center. Campus counseling centers are often nearby and convenient. Their services are confidential and typically free or offered at a reduced rate. If your school doesn't have a counseling center, you can contact your insurance company to locate a nearby provider. You can also contact a therapist, psychologist, or psychiatrist directly. All are professionals trained to help you deal with mental health issues you may face while studying in the U.S. Or you can call one of the confidential toll-free services highlighted at the end of this video. There are many myths about mental health and seeking help. Here are a few of the most common. Counseling is for crazy people. False. Millions of people in the U.S. get counseling, and studies show that most people who get help with a mental health problem improve dramatically or recover completely. In fact, seeking mental health care shows that you are motivated, self-aware, and empowered. Everyone will know I saw a counselor. False. In the United States, there are laws and professional ethics standards that prevent your doctor from disclosing information to your parents, friends, and school faculty. I can handle my own mental health problems. If I can't, that means I'm weak. False. Seeking help for a mental health issue is similar to seeking help for any other medical problem. If you broke your leg, you wouldn't try to heal yourself. Mental health is no different. If I talk about drinking alcohol or doing drugs, I'll get in trouble. False. Mental health professionals are available to help you through a difficult time, and their offices are considered a safe place to discuss your experiences and what you are going through. The things we discuss will become part of my permanent record and will be viewed negatively. False. The information you share with your counselor or other professional will remain confidential. It will not be a part of your school transcripts or any other school records. In summary, many students experience mental health challenges while in college. Professionals are ready to help you through frustrations, fears, and other obstacles you might face while studying overseas. If you or someone you know needs help, please see a mental health counselor or contact the following hotlines, which are toll-free and completely confidential.
Here at the University of Alabama, we have an excellent counseling center who is ready to help you. You can find out more about their information and their services at counseling.sa.ua.edu. They're located at the edge of campus at 1101 Jackson Avenue in the South Lawn Office Building in Suite 3000. You can call them at 205-348-3863, or if there's an emergency after hours, you can call them at 205-348-5454. That is the University of Alabama's police department, and they will put you in touch with the counselor on call after hours. You can also text BAMA, B-A-M-A, to 741-741 to text with a trained volunteer. In this video, we're going to go over some basic information about alcohol, tobacco, and drug use in the United States. This is a very difficult topic to cover, but for international students, it's important to know about age restrictions and the legality of certain substances.
What international students need to know about drugs and alcohol. As an international student, you may find yourself in a situation where you are around alcohol, tobacco, or drugs. It's important to know that the laws around alcohol, tobacco, and drugs vary country to country and even state by state, and that the U.S. has some of the most restrictive laws in the world. In this video, we will go over the laws related to drugs and alcohol in the U.S., how to act responsibly, consequences, and how to get help if you or someone you know has an addiction. While you are in the U.S., it's important to know the laws about drugs and alcohol, as breaking them can have negative consequences and could even impact your immigration status. You must be 21 years or older to drink alcohol or consume tobacco in the United States. This is one of the oldest ages in the world. This includes beer and alcoholic seltzer, wine, hard liquor, e-cigarettes, hookah, and cigarettes. This means you cannot drink or smoke, purchase, or even have alcohol or tobacco in your possession if you are younger than 21. If you are 21 or older, there are still laws that govern the amount you can drink and where. In most places, you are not allowed to have an open cup or bottle in a public location. It is also illegal to give an alcoholic beverage to someone under 21. You should never drink before or while driving. If you do drink, plan alternative transportation ahead of time, such as having a friend who hasn't been drinking drive you home or taking a taxi or rideshare service. If an international student is found driving under the influence of drugs or alcohol, known as a DUI in the USA, it can lead to immediate visa revocation, which would mean returning home and may prevent you from continuing your studies. In the United States, taking any drugs that are not prescribed by your physician is against the law. It is also illegal to give away your own prescriptions to someone else. While marijuana has become legal in a number of states, it is still against the law federally. This means that while residents of the state can consume marijuana, international students cannot consume, possess, or sell marijuana, regardless of what state you live in. Mixing drugs, especially with alcohol, can be very dangerous. And combining drugs is what leads to most overdose deaths and many accidents, including fatal car crashes. If you are 21 years or older and choose to drink, here are some tips on how to drink responsibly. 1. Eat before and while you drink. 2. Keep track of the number of drinks. Pace yourself and mix in water as often as possible. 3. Don't mix alcohol with caffeine, such as energy drinks. 4. Don't accept drinks from strangers. 5. Keep an eye on your drink at all times. If you walk away from it, get a new one. 6. Avoid shots, hard alcohol, drinking games, and keg stands. 7. If you are going to drive, don't drink at all, or plan to have someone else drive you home. And remember, you don't have to drink. Any bar or club serves non-alcoholic beverages, such as juice, soda, or mocktails. About half of college students in the U.S. don't drink alcohol or drink very rarely. Not only will breaking the law result in stiff punishments, such as high fines, jail sentences, or suspension of your driver's license, but it could impact your current visa and the ability to get another visa in the future. Your school may also have disciplinary responses for breaking the law, which could include suspension or expulsion, which could impact your visa status. The Substance Abuse and Mental Health Services Administration defines heavy alcohol use as drinking on 5 or more days in the past month. In some cases, drinking or taking drugs can lead to dependence or a substance use disorder, which can seriously impact your physical and emotional wellness. Here are a few warning signs. Change in personality. Problems at school. Blackouts. Change in tolerance. Concern by friends or family members. And loss of interest in hobbies or activities. If you or someone you know is struggling with alcohol or drug use, then it is important to get help. On-campus services, such as your student health center or counseling center, are there to help. Many communities also have free support groups to help with addiction, like Alcoholics Anonymous and Narcotics Anonymous. In an immediate crisis where someone you know needs help, call the campus or local police and stay with that person until help arrives or accompany them to the health center. You can also contact the Substance Abuse and Mental Health Services Administration, a completely confidential support line available 24 hours a day. For more information, check out our Insurance Explained section on internationalstudentinsurance.com.
As a reminder, understanding the law is important. Again, alcohol and smoking are legal if you're 21 years of age or older. International students can never possess or consume marijuana, even in states where it is legal, as it is a violation of federal law. Arrests for drinking alcohol and driving, a DUI or a DWI, will lead to an automatic visa revocation. The State Department takes drinking and driving very seriously. They consider it a number one public health threat. Alcohol arrests will lead to student non-academic misconduct charges at the University of Alabama. You would have to go through disciplinary action with the Student Conduct Office. Smoking and tobacco use are banned at the University of Alabama, and smoking is not allowed in most bars and restaurants. How to get help at UA. The University of Alabama is home to the Collegiate Recovery and Intervention Services. You can find their website at cris.sa.ua.edu. They're located at 1101 Jackson Avenue in the South Lawn Office Building in Suite 1000. Their daytime phone number is 205-348-2727. They are there with trained professionals to help you if you're having problems. And as always, you can come see your advisors here at the International Student and Scholar Services Office. We are open Monday through Friday, 8 a.m. until 4:45 p.m. If you need to see an advisor without an appointment, you can come for walk-in or virtual advising Monday through Thursday, 11 a.m. to 3 p.m. We are located, as always, in 105 BB Comer Hall.